Welcome to COVID Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. I have with me Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. I am Stephen Williams, Director of the Houston Health Department, and thank you to past President Kathy Finninger, who provides us with a ton of questions usually every week. Interesting. First is on transmission. Please comment on the recent decrease of cases in Houston and the new goal of 2.5 by mid-November. How do you think Texas is doing over in general?
So those are two questions. So first of all, I think here in Houston, in Harris County, we have done well. We've seen the positivity rate come down dramatically. Now it's kind of flattened off. This week, we, with the City of Houston, announced that we were at 5%, which had been a goal, but that was an arbitrary goal. Let's admit that. And so the mayor is, talking about is now shooting for another goal, 2.5%. And that's the point is we need to continue fighting this virus. We need to continue to recognize that the virus is a problem. Now the other part of the question is how is Texas doing? And it's concerning, the data that we're seeing coming from across Texas. And so maybe a little bit too early to say definitively, but I am worried about what we're hearing from our neighbors across the state.
Yeah, and I would just add is I think I completely agree with you, David, that we as a city, county, region have done a really just a really good job. And this is not patting anybody on the back. This is really a community, right? This is everybody together doing everything, and public health authorities and public health departments working with our healthcare system and all sorts of other community partners. So we've been able to drive this down. And you're right, it's not just getting to a number, it's actually crushing, it's actually getting better and really, at the end of the day, driving this down. But Stephen, as you've also said earlier today, we have colleagues across the state who are indicating that they're seeing increases. They're seeing increases in nursing homes or older population, but they're also seeing under the age of 40 increases there as well. And we know that and we had this conversation with our health authorities just this morning, that we know that if you have college kids that are going back and doing certain things, that sometimes it's showing that a couple of weeks later, it's actually in the senior population that you're starting to see cases or problems. So this is very, very difficult, but we are concerned about what we're going to, what we're starting to see across Texas.
Yes, I'd like to underscore that concerning. I'm just reading Texas that I've gotten within the last hour from colleagues around the state. It starts off, all of our cases have skyrocketed. That's one jurisdiction. Another, we're reporting over 700 cases today. That's a smaller jurisdiction than here. We're struggling too. Monitoring is basically gone. And here's one jurisdiction saying 3 weeks ago they were at 100 per day, 200, and now they've increased to 500. So I think that it's time for us to kind of reinforce the messages and to really stress that we're not out of the woods.
Right. And one thing, you said one thing I know is that people are worried about another lockdown or a shutdown or whatever, and boy, I get that, right? But if we want to prevent that, then we've got to wear the mask, we've got to wash our hands. I mean, all these things. So I see a lot of people in the supermarket with the thing down below their nose. That doesn't work. Sorry. You got to have it up over your nose. You can't, you got to be diligent. You got to really understand that. You got to be diligent.
Right.
Okay, can you share contact tracing data? For example, are people catching this virus while shopping with masks on in grocery stores?
I haven't seen anything with our contact tracing information that says that people are catching it with, from that kind of an activity of being in a grocery store. I will say that it has been difficult to unpack, and I think your earlier text from a colleague that you said something about, Stephen, about monitoring is very difficult. I think that's one of the challenges, because when you minimize activity outside of a home, when you minimize your interactions with others, and you have a smaller group of people you're around, then when the health departments then have to do contact tracing and contact you, it's a lot easier for us to be able to figure out where that potential transmission occurred. When everybody is doing a lot of things outside, it is very difficult for us to then pinpoint exactly where the transmission has come from.
Yeah, I think you're absolutely right. If I remember correctly, when we were looking at where people had gone, yes, grocery stores was one of the places that they frequent, but that is where most people go. But then you start looking down the list, you'll see, that they've gone to events, they've gone to restaurants and other places where people might not be so careful. We just got a text that's coming in. One Morning. Is there a backlog in county case count reporting? How reliable is the data right now?
Well, the data is reliable, I would say that. There remains the lag that we've seen and incomplete information. We've, as I talked about the last couple of weeks, we've automated processes, which has, I think, been very, very helpful in processing a number of cases that come through. We are getting backlogs. We have backlogs every day because we do get backlog information from the state and from other partners. But right now there is not a significant backlog. That said, we still have a lot of automation and a lot of other cases that we still have to go through.
Okay, another one came in. Pat Bates, she's making a comment. El Paso was almost out of ICU beds 2 days ago. Actually, I gave you the case, at least the case count for El Paso, I think today or yesterday. That was 700. That was the first thing that was mentioned on one of the texts that I had. The next question. Many pictures of people on voting lines seem close together. Some of my friends tried to vote on the left and left when they saw the lines with people so close. Please help. I guess that's really just an ongoing message for people to really distance yourselves while you're in voting lines, and I'm sure you would support that, right?
Absolutely, and Harris County has done a great job with those measures, but we also have to rely on people that are in those lines to also enact those.
Okay. Thank you for joining us for our COVID talk with local health authorities. We'll be right back.
Wash, washy, wash, washy, wash, wash your hands. Scrub it while you sing the song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census Survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
We have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
You told me not to talk to strangers. You told me not to cross the street without looking both ways.
You told me not to touch the stove.
You told me not to do drugs.
You told me not to drink and drive.
You gave me so many messages about how to stay safe. Why didn't you keep me safe by properly storing your gun?
COVID Talk with local health authorities, sponsored by the Rotary Club of Houston. This is actually a 3 or 4 part question, really. One healthy 25-year-old in Nevada was the first documented case in North America. We're talking about reinfections. Previously, one in Hong Kong appeared to be a different strain. How many strains are there right now? Do you suspect it is due to individual immunity? Has any research indicated that you can or cannot be reinfected with the same strain?
How many strains, yeah.
So I think there's thousands of strains, because every time there's a mutation, technically it's a new strain, right? But now, fortunately, the vast majority of those changes have no clinical impact whatsoever. But to this point, now, clinical impact in terms of how sick you get or those sorts of things. Now, to this person's question is, it really is a very complex question about your immunity. So if you have a 1 codon change in the genome, does your immune system not recognize it like it did the one that it was originally sensitized to? And I just don't know. I would think that it would be pretty decent immunity. So we are seeing people who are getting infected again, and the ones I know of, it's a different, there's a mutation, but I doubt that accounts for it. I think that what we're learning is if you get infected once, you absolutely can get infected again.
Right, and I think that's what we said for months and months ago, is that our concern is that if you did get infected, you would have some immunity for some period of time. We don't know how long, and it would eventually wane. And that's one of the reasons, Stephen, we've talked also about testing. That, you know, some people, you know, they say, when you say, when did you get tested? They say, did you get tested? Yes. When did you get tested? April. You're like, okay, but I have symptoms today. Are you going to get tested? No, I was negative in April. No. That negative test in April was only for April. You've got to really get tested again. And that's where this whole immunity and reinfection piece also comes in.
Okay, the NBA and the MLB seem to have done a rather good job creating a bubble. Are there any lessons learned that we could use other than putting us all in a bubble?
Well, I think the lesson learned is when you talk about a bubble, what you're talking about is really, really strict adherence to social distancing, mask wearing, all that. That's really strict adherence, and it works.
Right.
That's what you should learn.
That's right. And ingress egress is controlled by testing as well.
Right.
And there is this regular test. And you know, this has been the challenge across the country when you get outside of a controlled environment.
CDC now admits some COVID can linger in the air for minutes to hours and spread farther than 6 feet. Does that change the distance you recommend for social distancing?
So the recommendation hasn't changed. I think that what the CDC is doing is trying to balance a little bit of reality with the science. And so the science is exactly what that person said. But if we were to make the social distancing now be 12 feet and for 30 minutes, I mean, it's not achievable.
Right. I would rather people actually achieve the 6 feet minimum and do that well, rather than trying to say do something that people aren't following.
Some patients who recover from COVID experience a loss of hair. Could that be a symptom or an outcome? I had this discussion actually with a colleague earlier.
That'd be an outcome.
It would be an outcome, yeah.
It would be an outcome.
It would be an outcome.
I
was just going to say,
the only thing that makes your hair fall out?
That we're all like, we're not like the most hair endowed when it comes to that. So, you know, it is not a moniker.
Apparently, there are other things which will make your hair fall out.
Yeah, COVID wasn't around 40 years ago. Yeah, I got hair right here. I'm going to let it grow long, too.
That's right.
Dr. David Nabarro said, we're in the World Health Organization. Do not advocate lockdowns as a primary means of control of this virus. Everything in the news sounds like a new announcement, but given the word primary, this doesn't appear to have changed anything. What am I missing? He said primary.
I haven't seen that exact quote, but I think there's been talk about it, like, are there paths forward that don't include a full lockdown, if you will, quote unquote, and really ways that you can do other things. And for example, a New Zealand or South Korea are two examples of countries that they have enacted other kinds of measures, like robust contact tracing, surveillance, epidemiologic surveillance activities related to technology, et cetera, and also ingress-egress controls in nation states. That's obviously a lot that has to be unpacked. I think the challenge we have in this country is that we're not the United States of Harris County or United States of Texas. We are a country. And so having those kinds of controlled ingress-egress has become challenging. We do know that sometimes when Texans go to other states, they're asked to quarantine or they're asked to get tested. These are, real questions that are in play.
In August, there was an announcement that blood thinners may increase survival rate by 50% by preventing blood clots. Has this been given any additional consideration?
Yeah. So I'll tell you that my colleagues in the hospital, that once you get admitted for a COVID-related illness, they are absolutely looking to see if you've got clots, because it is a major problem with people who are hospitalized. Now, using blood thinners is not something to be done without close supervision. And so that's why we're not saying go get it over the counter, because you're going to create more problems than you're going to solve. It's got to be done very carefully.
Okay.
That's right.
Fluvoxamine has been around for years as an anti-inflammatory, and one research group said this could be used to prevent patients with mild symptoms from developing more severe symptoms. Is that accurate?
It's an anti-inflammatory and antidepressant.
Well, they said anti-inflammatory.
What's it called?
Fluvoxamine, Fluvoxamine.
Fluvoxamine. I think maybe one of the
I thought that was antidepressant.
I think you're thinking fluoxetine.
Well,
no,
we'll
anyway.
check the spelling doing
yeah, the bottom line is that, you know, as David just made the comment about this. I mean, we do know that NSAIDs and aspirin, there are some, you know, anti-inflammatory components. We do know in the hospital setting steroids work, IV steroids, but there has been no preventive piece of prophylactically in advance go ahead and take some medicine to prevent yourself.
Right.
Okay, very quickly, researchers at Virginia Commonwealth University in Richmond found pandemic indirectly caused an additional 75,000 deaths, March to July. University of Washington researchers predict nearly 400,000 will die from COVID or its consequences this year. Your thoughts?
Yeah, so I just talked with the medical examiner's office about this yesterday, ironically. So it's absolutely true. There is the expected death based on the population, what we would have expected. There is the additional deaths from COVID, and then there's this other delta. There's this other additional deaths that are occurring. And we didn't recognize those early here in Harris County. We didn't have them, but we certainly have them now. And what they're finding is a couple things. One is, tragically, there's an increased number of deaths in Harris County from violent trauma, shootings and stabbings. Okay. Now, that may be related to social stressors, people being out of work, whatever. Beyond that, it's a smattering of illnesses that are, so there's not one particular thing. And so there's a lot of concern that people aren't going and getting their medications refilled. They're not going to the doctor. They're not going to the emergency department when they're having chest pain or stroke symptoms. There's no one medical problem, but it seems to be a smattering. But definitely the penetrating, the violent related, that's way up.
And substance abuse as
and
well.
Substance
related
abuse,
to, right?
absolutely,
Yeah.
you're right. Yeah.
The only other thing I would say is that in the University of Washington, they've talked about wearing masks. Wear a mask.
Thank you for joining us for COVID Talk with local health authorities. We'll be right back. All right, we're going to have to do it.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
Wash hands now. Wash hands now. Wash hands now.
Hand washing is one of the best ways to stay healthy all year long.
My grandma always says everyone counts, and everyone who lives with us
is special. Like my aunt, who took me on my first bus ride to the library. Or my older cousin, who walked me to my first day of school. Even my mom's friend and her baby who live with us.
The census informs funding for schools, roads, healthcare, and more. So count everyone in your home, including all children on the 2020 census. It's your chance to help them for the next 10 years. You can respond online, by phone, or by mail. Shape your future. Start here. Learn more at 2020census.gov.
Jason, let's go see your room.
What do you think? We kept it a little spare, so you can decorate it how you like.
Dinner!
Go?
Excellent. Soccer is fun. Yeah, I saw you guys out there.
Hey!
Okay. If you love me enough to tolerate my perfect little pets and all their glorious dander, then of course you'll visit nhtsa.gov/the right seat to make sure I'm in the right car seat.
Back to COVID-19, talk about local health authorities. We've done some research during the break. Fluvoxamine.
So fluvoxamine is an antidepressant. Dr. Persse is absolutely right. It's very similar to Prozac, but it has an anti-inflammatory component. And there is some research being done. Can that anti-inflammatory component contribute to preventing people from being hospitalized or more severe illness? Again, too early to tell, but so there's somewhere, both of us had some component of it, but not all of it.
Okay, the next question is about drive-through flu shots. Are they going to be available in Harris County, given the fact that we're going into flu season and COVID?
Yeah, we haven't done drive-through per se. We have had flu clinics throughout, and I think the Houston Health Department is doing the similar thing. We were thinking we could actually put drive-through flu along with COVID testing, but honestly, if you think about some of the infection control, there were some challenges of doing that. So, but we do have on our website information on how you can go get your flu shot.
We had a small one over the weekend just to test it out to see how it works. Okay, Dr. Patel, Memorial Hermann suggested that there's a relationship between COVID and ischemic strokes. He said some younger patients with no significant risk factors show large vessels occlusion of OCCLUSION. What does this alert us to for older populations?
So this goes to the clotting issue that we're seeing with COVID. Yeah. And what's interesting is that, wearing my HFD EMS hat, is that we've seen a remarkable decrease in the number of calls to 911 for heart attacks and strokes. Yet at the hospitals, they're seeing this phenomenon. And so I don't know how to reconcile that in my head, but COVID can cause clotting problems can cause strokes, and it causes clotting problems of all ages.
That's right.
Okay, AARP had a story about COVID hallucinations, said it is from the effect the virus has on the brain. Those seem temporary, but delusions, confusion, and unresponsiveness appear to be more long-term. How widespread is this, and are there any preventive measures? Yeah, so I did look at this a bit, and I will say that it's unknown how widespread it is. So to answer the question, we don't know how widespread it is, but it has been reported that there are these psychological, psychiatric disturbances, or even neurologic disturbances that are longer-term consequences of COVID infection. Every week I have to say remdesivir. It's been approved for compassionate care. It seems very expensive. Is cost a deterrent for doctors who get approval to use this?
So one thing is they've changed the recommendation for remdesivir. It was for for compassionate care, and now they've opened it up. So basically hospitalized patients, and it is pretty expensive. I want to say it's about $300 a dose, and you get, what, 6 doses over 5 days or something like that,
That's
right? So
And I believe that's just for the medication,
Yeah.
not the administration
Right.
of the other additional
Right.
costs.
I would like to think doctors aren't hesitating because of the cost. Somebody needs it, they need it.
Yeah.
Okay. Because of COVID, nursing home residents have been isolated. Visitors could kill them. Preventing visitors could kill them. Where are we now, and what is less of a threat? Actually, nursing homes are allowing.
Yeah, and I'm
visitation.
not sure I completely agree with the premise that preventing visitors will kill them. We do know that social isolation is a huge issue for all of us, but especially our elderly. So I think there have been restrictions that have been eased up at the state level for nursing homes. Where we go with this is really just reminding everybody that if you do have somebody in a nursing home and you're going to visit, please take all the precautions. Please listen to what folks in the nursing home are saying. Please keep your loved ones safe.
Okay, I'm cutting this short. Everything I keep hearing about vitamin D to meds given to help with COVID cases, has anything changed in research, and should we all increase our intake as a preventive measure?
So there are a number of things, vitamin D, vitamin C, zinc, and magnesium, and a couple of others that people believe in, boost the immune system. I don't know that any of them specific to COVID have been shown to be, have been shown to be beneficial.
Mm-hmm. I'm taking some vitamin D and some vitamin B, and I'm also taking multivitamin and vitamin C. So, I mean, that's my recipe, and trying to get some sleep, but that's not working with 3 kids.
Yeah, sleep is probably better than those
probably
vitamins.
most important of all of them.
Okay, Johnson & Johnson paused phase 3 study. AstraZeneca is still on hold in the U.S. Can you share what is active and how is that looking? Things change weekly.
So is there a total of 6 or 7 vaccines? There was 7, wasn't
7,
there?
yeah.
And 3 of them are now been either paused or are still paused. So, but people should, so a couple things. One is this should be expected. If this didn't happen, I would have been worried. I wouldn't worry about it. It's going to slow things down, but.
So the process is working.
It sounds like the process, they're doing what they're supposed to be doing.
That's right.
Yeah.
Okay. Baylor's working on a trial, I heard, is for 5 days after you're positive, but I can't find anything about it. Can you share information? Have y'all heard about that?
I know Baylor's got, well, they have one vaccine trial underway and they're about to start a second one, but I don't think I know anything about this one.
Oh, this gets really personal. I was told that my long pandemic beard prevents my protection with the mask. Is that really true?
Well, so the mask that you wear, if you're wearing a simple mask, it's not so much to protect you, it's to protect the person next to you. So Stephen, you got a beard, you're wearing a mask. I don't think many droplets, because your beard will stop droplets from getting out too. So
that's right. It's a physical barrier.
Yeah, it's.
And he might be referring to maybe N95s where you have to be fit tested.
Well, now, if it's N95, then you may have a seal. You absolutely will have a seal
You will have to cut that beard off. Due to my severe asthma, I was told to have a LED air purifying system installed in order to make this work for COVID. Also, do you have any idea what I should make sure the system has, like perhaps ultraviolet light?
I don't.
Actually,
I don't. Go ahead.
Go ahead.
I don't have any specific recommendations based on that. I will say that if you're talking with your healthcare provider and they tell you you do need something like that, then I would take it seriously.
Yeah, and you can put ultraviolet lights in the
That's right.
system in addition to filters. I know we've done that in TB clinics. One last question. Exclusion of older persons from vaccine trials. Since it is the most at-risk population, why would they be excluded?
I don't know if they are being excluded.
Yeah, I don't think, this was a rumor that was previously that, in fact, I think we looked it up. It's not that they're being excluded. I think there were certain trials that were looking at different kinds of age populations. So I don't think it's true, but obviously we do want to make sure that it's safe in elderly and senior populations. Stephen, did you want to make a comment about census?
Well, today is the last day for census, right?
That's right.
And we encourage everybody to fill out those forms and send them in.
And to vote. Because
absolutely, everybody should vote.
That's
Express your opinion.
That's right.
You have been joining us with COVID Talk with local health authorities. With me was Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. Thank you to past President Kathy Finninger of Rotary Club of Houston, who sponsors this event almost 30 weeks in a row. And I am Stephen Williams, Director of the Houston Health Department. See you next week.